Video Vignette: An Ethical Approach to Antenatal Consultation at the Limits of Peri-Viability by Dr. Theophil Stokes. While you watch this vignette, please think about the physician's approach to counseling, including language and nonverbal communication, as well as the patient's reactions. What goes well? What could be improved? How can you incorporate changes into your own clinical practice?
Hi, Mrs. Allison?
Yes.
Is this an okay time to talk?
Yes.
Okay, hi.
Hi.
I'm Dr. Stokes. I'm one of the neonatologists.
Hi.
That means I'm one of the doctors that takes care of babies.
Okay.
And so I was asked by your obstetrician to come and talk to you. Did they explain that I'd be coming to talk to you, or did they say anything to you about it?
Yeah, they said that my contractions are getting closer together and that I might have to deliver my baby, and that you were going to come and talk to me about what that means.
So tell me what's sort of going on in your head right now. I know you look scared and things are probably happening really fast. And what's going on?
He's not supposed to be coming.
Right.
You know, I'm not even 6 months along yet, so
Your due date's like in April?
It's April 7th.
April 7th.
So I'm hoping that we can just maybe stop the labor.
Yeah.
I know that you can induce it, and they've given me some medicine to try and stop it. I'm hoping that works.
Yeah, and that's what the medicine is that they're giving you now. That they're giving it, but I was just talking to your doctor outside before I came in, and she was saying that she's concerned that even with the medicine that they're not going to be able to stop things because you're progressing a little bit faster than would usually be helped by that medicine. So they asked me to come and talk to you about the possibility that they're not going to be able to stop things, and that you may potentially end up having your baby very, very early. So you said he, right?
Yes.
Do you have a name picked out?
Yeah, Gavin.
Gavin.
After his dad.
After his dad, okay. So where's Dad?
He's in Afghanistan, so he's not here.
That's really, really hard. Have you been able to talk to him at all? Or?
Not today.
When's the last time you guys talked?
Yesterday morning.
Okay.
He was able to call me.
Okay. Do you have any other family or anybody that's with you, or who'd you come with today?
I just came by
Just
myself.
by yourself?
My parents are in Kentucky,
Okay. So who all do you live with at home?
Just myself, my daughter, my husband when he's here.
And your daughter, how old's your daughter?
She's 15 months.
15 months. What's her name?
Gabriel.
Gabriel.
Gabby for short.
Okay. Who's Gabby with right now?
Just one of my friends in the neighborhood.
Okay, so your family's in Kentucky, and Dad's in Afghanistan.
Yeah.
This must be pretty terrifying.
Yeah, I don't really understand what's happening. I don't understand why this why this is happening. This never happened with Gabby, so I don't.
So Gabby, the pregnancy was pretty okay, pretty uncomplicated.
Yeah, it was pretty good, I think, compared to some of the horror stories my friends have told me.
Do you have like friends that have ever had a baby born prematurely, or?
Yeah, I had a friend who had a baby prematurely, and he's fine.
Yeah. And how old is he now?
He's 2.
He's 2? Yeah. Yeah, I think, the reason they asked me to come talk to you today is that, a lot of babies are born prematurely, and premature means a lot of different things to a lot of different people. With Gavin right now, they told me that they think your pregnancy is at about 23 weeks into the pregnancy. So, a full-term pregnancy is about 40 weeks.
Right.
And so the pregnancy is just beyond the halfway point. And so with Gavin, we're talking about extremely, extremely premature. And that's a really scary place to be having to consider having a baby this small, and that's some of the things that I wanted to come and talk to you about today.
Okay.
To kind of, maybe help you make sense of this a little bit and kind of talk about what we're dealing with.
Yeah.
Okay.
Okay.
So, did the obstetrician say anything to you, or had you talked to any of them about having, delivering this early?
I'm pretty adamant on not.
Yeah, and I think
on
that's
trying
where we're
not
all
to.
at.
But they said that, then basically things didn't look really good, I guess, for stopping the labor, and that's why they wanted me to talk to you.
Okay. So, the hardest thing right now is that Gavin is at a point where he's just getting to the point in the pregnancy where he would have a chance of surviving outside of the uterus, outside of your belly. Okay, so, if this was a week or two earlier, there really wouldn't be anything that we could do to potentially save Gavin. And, if it was a little earlier in the pregnancy when he delivered, the likelihood is that he would die after birth, and there wouldn't be anything that we could do.
So it's a good thing that,
So it's a good
if this
thing
is happening, it's happening now.
that it's happening now, because we're at a point where there's a potential that we can save Gavin. And that's why we're talking today about some of the things that goes into that whole process of being able to save a baby that's born so small.
Okay.
Okay. So stop me if this gets overwhelming. And
Stop.
as if it gets overwhelming, yeah, I get, as soon as I said that, I felt pretty stupid for saying. But I mean, stop me if things are not making sense, or
Okay.
And ask questions, and we're going to kind of just try and get through this together and come up with a plan together, okay?
Okay.
So as I said, Gavin, right now, in order to be able to survive outside the uterus, outside your belly, he's going to need a lot of intensive care support. And so what that means is that somebody like me and a team of people from what we call the NICU, the Neonatal Intensive Care Unit, would be in the room at the time of delivery,
Okay.
so that when Gavin was born, that we could start treating him basically right away. Because in order for him to have any chance of surviving, he's going to need a lot of medical and procedural help, and it's going to need to start right after birth.
What's he gonna need?
So the biggest thing when he's born is that his lungs are very, very small and underdeveloped. We know that about babies at this age.
Can he use them?
And he can use them, but he's going to need some help, and that's the kind of thing that we can do in the
Okay.
delivery room. So, so if they're not able to stop things, and again, I'm hopeful, and we're hoping that they can, but if they're not, and you do end up delivering this early, what it would mean is that Gavin would need to be taken to a different part of the delivery room after birth. We call it a warmer. It's basically a table that has heat above to keep him warm, because he's going to be very, very small.
When would that be? After I could hold him for?
And that's another reason, I think it's important for us to talk, because sort of the idea of what is normal in the delivery room, having your baby and holding your baby and maybe nursing your baby right after birth, all of that stuff gets sort of turned upside down in this kind of a scenario. The reality is that Gavin is so small and so premature that in order to have any chance of surviving, we would need to sort of take him from the second he's born, and it would, and it's excruciating for moms and for families,
So I wouldn't get to
it wouldn't be
hold him at all.
if we decided that we were going to do, all of the things, all the intensive care support and all of that, the things that he would need to have a chance of surviving, then you wouldn't be able to hold him right away, and he would pretty quickly after birth need to be taken out of the delivery room to a different part of the hospital that we call the NICU, to be cared for. So you wouldn't be able to see him or hold him in those first, minutes or hours after birth until you were able to come down to the NICU, basically, to visit him. And a lot of that will depend on how things are going after delivery and when your obstetricians think you can come down and see him.
Okay.
So that's a really hard thing to have to wrap your arms around, is the fact that that you can't wrap your arms around him right away, that he's going to be taken away from you. And, and it's a really scary, awful thing to have to go through. What I can tell you is that during that time, and the reason we have to get him sort of away from you and to the NICU so quickly is that, as I mentioned, his lungs are going to be very, very underdeveloped. And so in order for him to be able to breathe and to get oxygen into his body, he's going to need the help from us that we can do. Things like a breathing tube in his mouth that goes into his windpipe, and like a breathing machine, what we call a ventilator. These are the kind of things that babies that are born this early, they need help with those kinds of things pretty much right from the time of birth in order to have a chance of surviving.
Okay. Can you, I don't know, is there any way that we can get in touch with my husband and, I don't know, see if maybe he can come back? And I can't make this decision on my own. I don't know what's...
And that's I think what I was gonna, while we're talking, I was just kind of thinking about that. I mean, I think that if there's anybody that you can think of, any family or any support that you want us to try and get here now, definitely we're going to get in touch with your husband. I assure you of that. And we have the Red Cross can get an emergency message to him overseas, but it's going to take some time.
How long?
I mean, it can take, depending on where he's at. I know he said that he's deployed, so we're going to do everything we can to get in touch with him as quickly as we can. And if potentially we can get him on a Skype call in the next few hours, even ideally, and get something set up here in the room. But,
okay.
Getting him back here and getting him back where we want him to be, which is right next to you right now, that's not going to be something we can do in the next few hours, and it's going to take some time. But we will work towards that.
I don't know. I really have to get home for my daughter. I'm not supposed to be in here. I don't know. So he is coming. We can't stop it, is what I'm hearing. The labor's going to happen.
That seems to be the most likely thing. I mean, they're trying, again, this medicine, they're trying to stop things, and we're trying to give you some medicine that will help with his, with Gavin's maturity, and to help his lungs develop, and to help him so that, he has the best chance after birth. But the concern is, so we know that, if Gavin is really as premature as we think he is, which is around 23 weeks, and really as small as they're estimating, we know that in these cases that the chances of survival, even with everything that we can do, can be less than 50%. That.
And I mean, do we know what the chances right now? I mean, could you give me a chance, like, better than less than 50%?
So I guess what I can say is that he has a chance. And the fact that you're here in this hospital at a place where we do this, regularly, means that, he has a chance. And have I seen babies that are born this early go home and, survive? Absolutely.
Okay.
So, all of those numbers and all the things I can tell you, they probably are sort of abstract sounding. Talking to you face to face, what we're dealing with right now is that Gavin has a chance of surviving.
Okay.
It's just he's going to need a lot of help. Sometimes families in this situation, parents in this situation, they sometimes, decide that they don't want to do all of the intensive care support. The other way that we sometimes take care of babies this age is to say, families can decide sometimes that they would rather spend the time that he has here sort of holding him and not being separated from him and not having him taken off into the NICU. I've taken care of babies and families in that situation where we've decided that, doing the intensive care is sort of too much, and that they didn't want their baby to go through those things, and they wanted to be able to spend the time that they had with their baby in the delivery room, kind of holding him.
What are you saying?
I think that hearing what you're telling me right now and kind of seeing where you're at, I think that's a really hard decision to really face. So I guess that I say that because I'm sort of taught that I need to talk about the idea that, some families might choose not to do all of the intensive care support.
And if we don't do the intensive care stuff,
that Gavin will die. We know that. And
like, beyond a reasonable doubt.
if we don't do the intensive care, if we don't start all of this stuff right away. You know, him being as small as he is, we know that he will die from that. And
okay.
And I guess I feel like I'm not saying this in a way that's making sense. I guess what I'm saying is that there are options that we are talking about, and that I want to help us sort of come up with a plan as to what we think is going to be the best for Gavin.
It's just a lot.
Yeah.
And I really can't make that kind of a decision without my husband's supposed to be here with me, helping me through this, you know, and he's not. He can't help that, but he's not. And I don't know what the right answer is. So, I don't know. What would you do?
Yeah, I worried that you were going to ask me that. I think that, so, you know, what I'm taught is that I'm not supposed to sort of tell you one way or another, you know, what we should do and which way to go and what the best answer is.
But if I was your wife, what would you tell her? Please, I know, I'm sorry, but I don't know what to do.
Well, you know, the reality is, like, I've talked to my wife about this, and, you know, this is something that we discuss it, and I think, honestly, it would be impossible for me to make that decision before my baby was born. I just think that it's not something that I'd be able to do without seeing him and without, you know, seeing who he really is after birth. So I think if what we were in this situation, I think probably what we would do is we would try and see how he does and kind of reassess from there. When I say try, I mean, you know, to try to provide him the intensive care support, to see if those things are working, to see if he has enough lungs to be able to survive. I think that in my experience, what I've seen is that, you know, babies, when they're born, they'll tell us a lot in those minutes and hours after birth. And if it seems like, you know, we're able to breathe for him and we're able to support his heart and his blood pressure and he's responding to the things that we're doing, then I would say my suggestion and what I would probably do is, if this was my wife and I'm making decisions, we would try. I think the hard thing is, you know, if things aren't working, we also would have to, what I would recommend is that if, you know, we see things aren't working and the interventions, you know, the breathing machines and the medicines aren't helping, and if he's really not responding to those things, then I would ask, you know, you to trust me as a doctor that does this, to say, you know, to trust my decision, which would be that, you know, to sort of recommend that if things aren't working, that we stop the intensive care and move towards what we call palliative care or comfort care.
Okay.
So that, you know, what my hope is that, you know, Gavin's born and he's strong enough and responds to these things, and we can get your husband back here,
yeah,
and maybe get some of your family up here, and, you know, have these supportive, loving people around you so that you're not up here by yourself.
Okay.
And, you know, and to see how things go with Gavin, and so that's, I guess, what I'm recommending, even though I'm not technically supposed to be making this.
No,
I think
that's a good plan.
I think
I think that's good. I think we should try everything and see how he is. I think he's going to be really strong.
Yeah.
I think he will. I think he'll do good.
And, you know, like, I can tell you, I know this sounds sad, and the stuff I'm telling you is a lot of bad news, but I mean, babies can and do survive this, and they do. Otherwise, I wouldn't be here, and I'm not going to do things unless I think there's a chance of them helping. And so I can tell you that, you know, you're delivering in a good place,
okay,
and we're going to do everything that we can for Gavin, and
okay,
and also to, you know, to try and get your husband, to get Gavin Sr. back here so that he's here. We will definitely start working on that now.
Okay.
Mm-hmm. I can say that, you know, myself or somebody else from the NICU is always going to be available to come down and talk to you. So if, you know, after we're done talking today and I turn around and walk out the room and 1,000 other thoughts come into your head, you know, just let your nurses know, and we're going to be back here. So we're here to talk to you and support you and help you through this. I'm not just Gavin's doctor. I'm here taking care of you as best as I can as well.
Okay.
So I just want you to know that that's why I'm here, okay, and why our team's here. And I think that we just are gonna, take this step by step and go from there.
Okay.
Okay.
Mm-hmm.
So I'm gonna let our NICU team know that we talked, and we'll have the delivery room set up so that when Gavin is born, that we're ready to take care of him. Okay.
Okay.
So I'll tell you that, if things happen quickly, it may seem like a blur, and it may seem like, you're not able to see what's happening, or it may seem like an eternity between the time you deliver and the time you're actually able to see Gavin. I can tell you that during that time, we're going to be doing everything we can to take care of him, and that even though he's not right here next to you, that he's going to be with me or one of my other team members.
Will I be able to get updates?
And that we're going to be updating you as quickly as we can.
Okay.
So my job is to make sure that, I try to make sure that at least in that an early period, that not more than a half hour goes by before, somebody's coming down to give you an update. Or the other alternative is that we'll make sure you have the phone number for the NICU so that you can be calling down there. But we're going to be making sure that communication is ongoing.
Okay.
Now, I say, a half hour, that can seem like an eternity. And the reality is it's not great, but we'll do everything we can to make sure that you're hearing what's going on. I think we also have, we'll identify somebody that can be taking pictures so that, if we do have to rush him to the unit right after he's born, that they can take pictures and bring it back to you and show you. And,
Okay.
We'll do what we have to do to work with what we've got.
Okay.
Okay. But, and so I think that we'll, as we set up more and come back into the room, we'll talk a little bit more.
Okay.
And my hope would be that over the next few hours, if we can get through to your husband's command. So I think we'll start working on that now. I'll talk to our social worker and see if she can, start that process. And then what we may be able to do in the next few hours is maybe have a sort of virtual conference with you guys as well. Okay, because I think we have a few hours for sure.
Okay.
So we'll try and get moving on that as quickly as we can. Okay.
Okay.
All right. All right. Well, it's really nice meeting you, and I'm sorry that it's like this.
Thank you.
But we're going to do everything that we can. Okay.
Okay.
All right.
Thank you.
Okay. I'll see you later.
Bye.
Okay.
Now that you've watched this vignette, please think about the physician's approach to counseling, including language and nonverbal communication, as well as the patient's reactions. What went well?